My topic is venous blood. Definition. Venous blood is the oxygenated blood which travels from the peripheral vessels through the venous system into the right atrium. The oxygenated blood is then pumped by the right ventricle to launch by the pulmonary artery, which is divided in two branches, left to right to the left to right launch, respectively. Application medicine. Blood transfusion. In a blood transfusion, donated blood is added to your own blood. A blood transfusion may also be done to supplement various components of your blood with donated blood products. In rare cases, a blood transfusion is done with blood that you donate ahead of time before you undergo surgery. During a typical blood transfusion, certain parts of blood are delivered through an intravenous IV, like that placed in one of the veins in your arm. A blood transfusion usually takes 1 or 2 hours, though in an emergency it can be done much faster.
Bacterial pneumonia and intra-abdominal infections. In some cases, yeast are recovered in blood cultures as well. Blood culture is usually performed by venipuncture, but can also be collected from indwelling lines. Aerobic and anaerobic
Application in medicine laboratory. Laboratory tests are thought helpful in evaluating the health status of an individual. It's important to realize the laboratory result might be out of the so-called normal range for many reasons. This variation may be due to such things as right dietetic preference, age, sex, menstrual cycle, degree of physical activity, problems with collection and or healthy of the specimen, non-prescription drugs, aspirin, cold medicines, vitamins, etc., prescription drugs, alcohol intake, and a number of non-illness relation factors. Pros: complete blood count, CBC, common component of the CBC, red blood cell count, hemoglobin, hematocrit, plaque, white blood cell count.
I have a site for you to sign, match your blood, O positive. Sign here that you consent to the transfusion. Great. Flush your line with saline just to make sure it's pain.
Cons: no analysis and monitoring in performance to diagnose and manage the oxygen status and acid-basic balance of the patient. Problems with collection and or holding of the specimen. Disease, leukemia and anemia. Leukemia is cancer of the white blood cell. Anemia, The most common cause of anemia isn't having enough iron.
Blood also helps fight infection and heal wounds. Blood consists of a liquid portion and cellular components. The liquid, called plasma, is where nutrients, hormones, clotting factors, and other chemicals are.
Leukemia. White blood cells help your body fight infection. Your blood cells form in your bone marrow. In leukemia, the bone marrow produces a normal white blood cell. These cells crowd out the helping blood cell, making it hard for blood to do its work. There are different types of leukemia include acute lymphocyte leukemia, acute myeloid leukemia, chronic lymphocyte leukemia, chronic myeloid leukemia.
So the first thing I'm going to do is I'm going to divide this diagram in half. I'm going to divide it in half horizontally, so I'm going to draw this line down the middle. And that would split up the cells according to how mature.
Anemia. Anemia has three causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pronounced ulcer, colon polyps, or colon cancer. A diet that doesn't have enough iron, folic acid, or vitamin B12.
Vitamin deficiency anemia, and anemia of chronic disease. Common causes of low iron are heavy periods in females, pregnancy, ulcers,
Thank you very
colon
much.
polyps,